Good morning, everybody. I am Jordan Hassel,
I'm Devonna Bird.
and our presentation is on interventions for rib dysfunction. So for our objectives today for this presentation, we're going to review what rib dysfunction is and its causes. We're going to discuss 3 different impairments that are associated with rib dysfunction. We'll identify supporting interventions to address each functional limitation, demonstrate the intervention, and then explain how each treatment will provide benefits to the patient. So to start off, we're going to talk about what is rib dysfunction. So rib dysfunction refers to the misalignment or impaired mobility of one or more ribs, and this can significantly impact movement, breathing, or posture. It's classified into 3 main categories. So you have structural, torsional, and respiratory. So structural occurs due to trauma, joint displacement, or mechanical stress of the ribs. And then torsional can result from abnormal twisting or rotation. And then respiratory just affects how the ribs move during breathing.
Right, so the 3 functional limitations we're going to target is limited upper body movement, pain or difficulty with respiration, and then postural differences. So for limited upper body movement, rib dysfunction can restrict the thoracic spine motion, especially like rotation and side bending, and limit unilateral arm elevation, particularly in the first rib dysfunctions. Then for pain and difficulty with respiration, deep breathing, coughing, sneezing, and joint rotation may be painful due to the costovertebral or costotransverse joint involvement. And then postural deficits of pain and joint restrictions may impair posture and reduce spinal mobility, especially with activities requiring sustained positions or repetitive trunk upper limb movement.
So now we're going to get into the specific interventions for rib dysfunction. So going off of our first impairment that we talked about, which was limited upper body movement, for our maximal protection phase, our focus is on pain control, gentle movement initiation, and muscle activation. So for this, you may see some gentle thoracic active range of motion exercises, such as cat-cow, which will help improve mobility. We can also do isometric scapular retractions and depressions, which will just promote early muscular engagement without excessive strain. And then we also have pendulum arm swings, which can introduce pain-free movement to the upper extremity. For the moderate protection phase, we're going to begin to introduce resistance-based and active movement strategies. So our first one that we have is resistance band rows, which will just help strengthen the scapular stabilizers. We have scapular punches in wall angels, which can encourage proper scapular mechanics and thoracic extensions. And then we have wall-assisted overhead reaches, which can improve shoulder mobility while keeping the rib cage in an optimal position. And then finally, for the minimal protection phase, we have overhead press with light weights, which can just help to restore strength for overhead activities. We have body weight plank with scapular control, which will reinforce core and scapular stability. And then we have functional carrying tasks. And this can be like holding a laundry basket or carrying the groceries inside the house. And this will just help to simulate real life scenarios that the patient may have to go through. So to start off with our demonstration, I'm going to have Lexi do cat-cow. So Lexi, I'll get you over here at the mat. I'm going to get you in the quadruped position. So on your hands and your knees for me. Perfect. So to start, we're going to go into the cat position. So I want you to really round your back out, bring your head down, looking towards the table. Just really arch your back for me to start off. Perfect. I'd have her hold this position for just a couple seconds, and then nice and slow, I want you to come out of that position. We'll go into the cow, which is where you're going to really round your back out. Good, and look up at the sky. You'll hold this position for a couple seconds. And so I would instruct her to do this nice and slow for about 8 reps, then take a break, and we could do 2 or 3 sets of that. And then for our moderate protection phase, we're going to do resistance band rows. And we have this full resistance band that Lexi brought in for us today. So Lexi, I'll just have you sit down, long sitting on the mat for me. Let's see if we can get this right. Bring feet together for me. Perfect. There we go. Yeah. And so we'll have her grab that, and I'm going to have you pull that band back. Good. Get a nice squeeze between your shoulder blades. Good. Hold that, and then come back out. And once again, I'd have her do this nice and slow. I'd have her do about 8 to 10 reps, take a break, and we do about 3 sets of that one. I'll take this from you. And then finally, for our minimal protection phase, I'm gonna have her do overhead press with light weights using these dumbbells. So Lexi, if you wanna sit on the edge of the mat facing that way. So I'm just gonna have you take these weights, bring them up, and you're just gonna nice and slow raise them up, come back down. And this one, I could have her do about 8 to 10 reps, take a break, and depending on how difficult it is for her, we could have her do 2 to 3 sets. Another exercise with this could just simply be walking around carrying the weights around the clinic, around the classroom, just to stimulate having to carry weight for some of those functional activities that we talked about. So let's take this from it. And now we're going to move on to our second impairment. Alright, so now we're going to talk about intervention strategies for any pain or difficulty with respiration. So for our maximal protection phase, we want to focus on just basic breathing techniques and gentle decompression. So we can do diaphragmatic breathing and hook line, which will encourage efficient breath mechanics and just reduce reliance on accessory muscles. We can have the patient do pursed lip breathing, which will help control exhalation and maintain lung expansion. Then we can also do thoracic decompression, and we can do this sideline with a towel roll. And this will just gently mobilize the ribs and reduce stiffness. Then next for the moderate protection phase, we're going to advance to more active and segmental breathing strategies. So for this, we can start with segmental breathing with tactile cues. And so this will just help the patient learn how to expand specific regions of the ribs. We also have breathing during gentle thoracic movement drills. So this would improve coordination of rib motion with spinal mobility. So this could be as simple as having your patient sit down, twist, do some thoracic rotations, and as they're rotating, tell them to take a nice breath in and then breathe out as they twist back to neutral. And then third, we have straw blowing tasks. And so this will just encourage slow, controlled exhalation and will reduce tension in the rib cage. Then finally, for the minimum protection phase, we have breath to movement coordination. So this will help teach the patient how to synchronize breathing with physical activity. So you could say with certain activities, if they're lifting a weight, like we had Alexi just do, when she's lifting it, inhale, and when she's exhaling, or when she's lowering it to exhale. Then secondly, we have functional aerobics, and this could be something as simple as walking or going up or down the stairs. And this will just help to retrain the breathing and certain daily tasks that the patient will have to go through. And then third, we have yoga poses, such as the child's pose or the cobra. And this will emphasize controlled deep breathing and thoracic mobility. So to start off with our demonstration, I'm gonna have Lexi do diaphragmatic breathing and hook line. So Lexi, I'll have you come over here for me. I will get you to lay down on your back with your knees bent. Okay. I want you to put one hand over your chest, the other over your stomach, like how you have it. And I want you to focus on taking deep breaths in through your nose. And when you're doing that, I want you to watch as your stomach expands and your hand raises up. And then breathe out through your mouth and watch as your hand lowers down and your stomach goes back down. We want to focus on trying not to move the chest too much with this one. Perfect. And so for this, I could have Lexi do this for about a solid minute, so we could get about 10 to 12 deep breaths. Take a break, and then we could resume this for another set as well. And then next, for our moderate protection phase, I'm going to demonstrate the straw blowing task, which actually I want to grab the straw that I brought. So I would just instruct the patient to place this straw in between their mouth. And what they're gonna do with this one is they're going to try to take a deep breath, breathing only through the straw, hold it for a couple seconds, and then breathe out only through the straw. And so just like the last one, I can have Lexi do this for about a solid minute to get around 10 to 12 deep breaths, and then rest. And then we could do that for another set and see how she did with that. And so that would be our intervention for the moderate protection phase.
Now for the minimum protection phase, as Jordan already explained, one of the interventions that I wanted to have the patient do would be breathing through yoga poses. So I will have my patient to perform the child's pose, but I will explain and demonstrate it to them first. So I will have the patient to come over to the plant and then to start with a wide base of support on the plant, and then pillow isn't really necessary yet. But if the patient had any discomfort with like pelvic tilt whenever they're trying to go down into the child's pose, they can take the pillow and put it underneath their butt, because they can walk down and lower to the plant and be in the child's pose. And then they would hold it for about 10 seconds, release, back up. Let's do it. Do you need a pillow? Alright, so you can walk your hands down, good stretch. Alright. And this exercise targets the diaphragm, core stabilizers, and the rector spinae, because the diaphragm, like relaxation, allows like a full excursion. The intercostals also are involved because of a gentle stretch with deep breathing. The rector spinae passively lengthens, and then the latissimus dorsi is really targeted because the arms are stretched forward. So they would hold the exercise for 10 seconds, relax, and then they can complete this about 10 times, really just controlling their breathing, because this helps with expanding the ribs through the back to allow for the airway to be opened up. Alright. The last functional limitation we would target would be the postural deficits. So for the maximum protection phase, we would implement supported posture with the lumbar roll and back support, chin tucks and scapular set drills, as well as seated pelvic tilts. For the moderate protection phase, it would be wall posture holds with their back against the wall with tactile cues, quadruped rocking with scapular control, and seated thoracic extension over the chair back. And then for the minimum protection phase, we have functional posture during lifting or squatting, posture with multitasking, like holding a load like a laundry basket, or even your child if you have children. And then advanced core would be planks or side planks. So for the maximum protection phase, I will start with having my patient to do some seated pelvic tilts. I would instruct the patient that they would come and kind of sit off of the edge of the chair, and then really work on, well, this chair isn't really best for my height, but you would tilt anteriorly like you're arching, and then posteriorly as if you're like rounding your shoulders. And then if I needed to, I can have my patient sit on the plant just for education purposes. Just so I can have access to the and say they were having issues with knowing how to initiate and really target the pelvic tilt. So I would put my fingers, well, if it's okay if I touch it. My index fingers would be over the ASIS, and then my thumbs would be over their PSIS, and then I can like implement, like showing them how to anteriorly and posteriorly tilt their pelvis if they needed some correction as far as knowing how to properly perform it. And then I would have them come over to the chair and practice it. And I would there to make sure. Okay. So the anterior pelvic tilt and the posterior pelvic tilt, and just seated pelvic tilts in general, I would have them do 3 sets of 10. The anterior pelvic tilt, it would target the rector spinae, the hip flexors, and the posterior would target the abdominals, the glute max, and also the hamstrings a little bit. Okay. And then for the moderate protection phase, I would have them to perform the quadruped, and I will demonstrate it for them. I'm gonna lower this table down. So I'm tall enough to get on it. So I would instruct them to get in the quadruped position, hands and knees, and then this one I would have it to be multi-directional quadruped rocking. So forward, back, because they would have like a wider base of support. I'm not worried about like them being on the plinth. But if they needed a mat, if they would feel more secure, then we could get like a low floor mat too. Alright. So you rock forward and back, counting to 10. So 1 would be forward, 2 would be back, 3, 4, 5, 6, all the way to 10. And then side to side, the same thing. Count to 10, back and forth, side to side. So the muscles targeted here would be the transverse abdominals, your multifidus, rectus abdominals, then your spinal muscles, erector spinae, quadratus lumborum, and it also targets your shoulder muscles and as well as the hip muscles because to stabilize. Alright, and then for the minimum protection phase, I would have my patient to perform a regular plank rather than a side plank. And again, I would feel comfortable with them being on the plinth if they're okay with it. But I would just demonstrate for them first if you need it. So you would get into a plank position and make sure that they keep their back level without trying to lift their butt and try to compensate. That would happen to the So we all know like the plank is a really ideal core targeting exercise. So you make sure that their butt stays down so that they're not compensating. Like I said, you will hold it for about 45 seconds or 30 seconds depending on if they could do 30 seconds or 45 seconds. And then again, that would target the rectus and transverse abdominals, the obliques, multifidus, glutes, and as well as the shoulder stabilizer.
Alright, so an overview of what we covered. So rib dysfunction, as we talked about, is the misalignment or impaired mobility of the ribs. It can lead to pain, restricted mobility, and certain postural issues. So it's important that we have proper rehabilitation, which would include phase interventions focused on mobility, stability, and function. And through addressing upper body mobility, breathing mechanics, and postural control, we can help strive for long-term recovery for the patient. And these are the references that we used. Thank you all for your time. Are there any questions? Here, oh, sorry, son.
Why would you do the breathing in supine?
In the hook line?
Yeah.
So in that position, it helps provide some trunk and pelvic stability while reducing compensatory movements and allowing the patient to really focus on getting full diaphragmatic breathing.
I was gonna say with the straw breathing, is that like just full empty to like deep breaths, or is there a specific pattern that you do?
You can do certain patterns if you wanted to do like a pulse breathing, but for what I was showing Lexi, it would just be just full inhale, full exhale, strictly through the straw.
So y'all have differential diagnosis, right? This semester?
Yes, sir.
Okay. So if you had a person who had severe or uncontrollable hypertension and you want to do that, what do you think would be the best position for that person to be in?
For the straw blowing,
Yeah.
severe hypertension. Maybe supine, just to allow the patient to fully relax and not be putting extra stress on their body while they're doing that.
Okay. So according to the literature, if you have a patient who has like severe or uncontrollable hypertension, and if they have hypertension in the medical record, you kind of want to be cautious. So when you have somebody doing something in the supine position, the supine position can likely increase blood pressure even more. So you want to be cautious of that and maybe elevate that person.
Yes, sir.
Tilt the headrest, elevate
That
them
makes
some,
sense.
right? You have them do it sitting, because typically position, it increases the blood pressure.
Yes, sir.
So that's a differential type of diagnosis, type question, like things you have to know when you're working with your patient, when you want to implement certain things. So they can ask you that on the National Physical Therapy exam. That's why I asked that. Another thing that they can ask you on the National Physical Therapy exam, they like to give you a history. So if a patient has hypertension, you want to be, and you get a positional question. You don't want to position the patient in supine if they have hypertension. Based on the answer choices, then you gotta look at the answer choices. Another condition that they like to put on there that a lot of geriatric population may have, when you look at the medical history, is GERD. You heard of GERD?
Yes, sir.
So you go GERD, right? They have GERD, but you wanna work on this. You wanna work on it, but they have GERD and they just came to you after eating lunch. Some patients come after lunch. They have 1 o'clock appointment, 2 o'clock appointment, and they just eat lunch. What's gonna be the best position if you wanna implement something like this?
Ladies, yeah, sitting up, elevated.
There you go, sitting up elevated. So you're gonna avoid hook line or supine
Yes, sir.
in those instances. But I'm just priming you for National Physical Therapy exam, like giving you points, hoping that this sticks. Because now, okay, I'm not gonna give it away. You may see this again.
I think you should.